Camille, when you talk to patients, see patients in clinic with CLL on ibrutinib, what side effects are you looking for, particularly in terms of, how they're tolerating the drug? What do you ask them about?
Well, once they get the drug, we always see them about 2 weeks after to kind of see where things are. Sometimes the fatigue will get worse before it gets better, depending on what's going on with the patient. And so I let them know that ahead of time, that it will get better. Those first few weeks can be rough. There can be increased joint pain. There can be rashes. I feel like we see a lot of rashes, and so that's something to watch for. Obviously, there are bleeding risks. There are also issues with the heart. So I'm always asking, are you having dizziness, shortness of breath, all of those things. Are you having, like, your heart's racing? We have to watch for that. But yeah, the first few weeks, you really have to sort of encourage them that it will get better, because some patients have a hard time.
Yeah, we have to be really careful about how we educate them about things that they were doing up until ibrutinib. So, for example, the bleeding risk, maybe no aspirin or other drugs that might increase the bleeding risk. So it's important education.
Absolutely.
I think Nathan was told not to use like a table saw just in case,
Yes. Absolutely. No, right now it's just no heavy machinery. Like, no, it's just, we're not cutting down trees.
I've been told that for years, but I think it's something different.
Did we tell him that, or
Yeah,
did you tell him?
No, actually, I think it was you guys.
No, I think I probably told him that. Yeah, I told a lot of our patients that.
So, Camille, again, sticking with you, how do you ask them about adherence? The drug doesn't work unless it passes the lips.
A lot of times I just start with, are you having any trouble getting your refills, right? Are you getting them on time? I ask about that a lot to make sure that they're getting them.
You just go to Walgreens and pick it up?
Right, exactly. They have to come from a specialty pharmacy. Oh. We are very fortunate that we have a specialty pharmacy with the practice that is amazing, and it calls the patient, they do education, they make sure, but still, with insurance and assistance and with the turn of the year and all of that, people's insurance changes, I always start with that, and then it kind of opens the conversation. Mm-hmm.
And Doreen, how about other ways of, forgetting to take your pill?
Yeah, I think adherence is so important, and you set yourself a timer on your phone if you need to. I'm keeping a diary with the clinical trial, so that helps me to remember, because I have to check off that I've taken the medication. So we're so lucky to be alive. We have to do our part and adhere to the dosing requirements and our schedules. Yeah.
Nathan, are there any restrictions on what else you can take around the time you take that pill? Any food restrictions or other drugs?
The main one is with ibrutinib is grapefruit and some certain type of orange.
Seville. I've never seen one.
Yeah. I guess it's in marmalade, so I avoid marmalade. Other than that, for me, it's hard because I was otherwise healthy, so I went through periods where I took a multivitamin, but I was on 0 prescription medications prior to this. So I do my best to stick to my daily routine with taking it.
One point I'd like to make is that it's also important for patients on these drugs, ibrutinib or other drugs, to let their doctors know, their providers know, if some other doctor prescribes another medication, because they're now very, very complicated drug-drug interactions, and we always do a computer search and look at someone's new medications, because it can dramatically change how the drug is metabolized in the body, and it may either make the dose much higher than intended or much lower. And so I just think it's important that they discuss that with their physicians.
That's critically important to do, and not only with their oncologist, don't ask the doctor who's prescribing the other drug, ask the oncologist who's prescribing the chemotherapy pill. And along those lines, the other group of people that have kept us and our patients out of harm's way are the pharmacists. But they have a challenge here because, as Camille pointed out, these drugs are coming from specialty pharmacies, and they may not know that our patients who are being prescribed one thing by their PCP or some specialist is getting that drug. So again, letting the pharmacist know, but especially letting your oncologist know. Yes?
Just to kind of back up what Ian was saying, herbal supplements. We really have to be careful with herbal supplements too. because we don't know how some of these things react with these oral drugs. So the patients really have to make sure and let us know if they're thinking about starting even a diet pill or something, anything that maybe seems safe over the counter.